Coming up on Medical Economics Weekly, an Instagram for medical images, physicians aren't benefiting from ACOs, and can care coordinators expand access to primary care? All of that and more coming up. You're watching Medical Economics Weekly. I'm Kevin Stout.
I'm Brandon Glenn, and this is the show where we keep you up to date on trending news about healthcare, practice management, and healthcare social media. Accountable care organizations are a key part of federal health reform, but a new survey suggests that physicians should lower their financial expectations when it comes to ACOs. A survey of about 1,400 physicians by Jackson Healthcare found that of those who've joined an ACO, 67% say it hasn't benefited them financially, such as in the form of bonus payments or shared savings. In contrast, 14% said they had benefited financially from an ACO, and 19% weren't sure. Now, a couple caveats here are that this was a pretty small sample size, and ACOs are also still pretty new. Nonetheless, physicians joining an ACO may want to opt for one that is led by a physician group rather than a hospital. That's because experts say physician-led ACOs are more likely to offer greater flexibility in how they determine shared savings and other compensation.
Recently, we reported on health startup ConsultingMD and their $10 million funding round. ConsultingMD is a service that provides two products. The service we find most interesting is the platform the startup has created that allows specialists to give patients second opinions virtually. The other service creates a large, localized referral network of the top doctors in the patient's area. We just interviewed Evan Richardson, VP of Product at ConsultingMD, to talk to him about how this new startup can benefit physicians. Here's a clip from the interview.
ConsultingMD at the end of the day is really about expanding access to world-class care for patients, and at the same time, expanding the ability of world-class physicians to impact patient care.
To see more of the interview and read more about ConsultingMD, click the link in our show notes below.
An article in the most recent print issue of Medical Economics explores what care coordinators can do for medical practices. First, what is a care coordinator? Essentially, it's someone who helps patients navigate through the health delivery process. Care coordinators are most often social workers or employees of large health systems or big group practices. The goal is that care coordinators will help improve access to healthcare, improve outcomes, and reduce costs. One example of helping achieve those goals is by reducing the number of patients who don't show up for appointments. One pilot project at a cancer center in Cleveland, Ohio, found that a care coordinator job essentially paid for itself in 3 months by reducing no-shows for radiation therapy sessions. In the future, the expectation is that care coordinators will play a greater role in healthcare delivery. That's because more people who don't have a lot of experience with the healthcare system are expected to obtain insurance coverage under the Affordable Care Act.
Vitals.com, the physician rating platform, has just raised $22 million in third-round funding to improve its customer-facing platform. Vitals.com is getting ready for the increasing demand for these sort of tools to help consumers find doctors. Vitals.com CEO Mitch Rothschild was quoted by Moby Health News that the new funding has nothing to do with recent movements in the space. We've committed millions and millions of dollars and a couple dozen people nonstop to building this up. Other than us and a company called HealthGrades, there's really no one else. Doximity is a Facebook for doctors. They're not going to have the depth of data. And HealthTap actually bought a dying database from a company called AVO, which we looked at and we said, eh.
One of the biggest debates happening in medicine today is over expanding the role of non-physician health providers like nurse practitioners and physician assistants to provide health services that have traditionally been the purview of physicians. Researchers behind a new study in Health Affairs decided to see what patients thought about this, and the answer is patients are open to it. In a survey of 2,000 patients who had received medical care in the last year, half said that given the choice, they'd prefer to see a physician. The other half was about evenly divided between preferring an NP or a PA and having no preference. But things change even more when patients are presented with the prospect of having to wait a day to see a physician for a minor ailment like a worsening cough. In that case, 60% would prefer to see an NP or PA today, while just 25% preferred to wait to see a physician tomorrow. Now, the scope of practice issue is one that won't be going away anytime soon, so stay tuned to Medical Economics for continuing coverage.
Toronto-based physician Dr. Joshua Landy has just released a new app that can be an interesting social experience for doctors. The app, Figure One, is basically an Instagram for doctors. Figure One is a crowdsourced photo sharing app just for healthcare professionals. Landy sees the app as sort of a Wikipedia for medical images. Healthcare professionals can submit photos to the app as long as they adhere to strict privacy guidelines to protect patient privacy. No numbers have been released yet, but Landy has mentioned that the user base for the app is already well into the thousands. The app definitely looks like it could be a go-to way for physicians to share medical images with other healthcare professionals. But don't just take our word for it. Download Figure One. We put a link to the app in our show notes below. And now for our tweet of the week. User Dr. Rocambole replied to a medical economics tweet. Our tweet was about increased red meat consumption leading to diabetes. He replied, "Yeah, and it doesn't help that beef is readily available across national fast food chains. More should be done." Thanks for the reply, Dr. Rocambole. And to be featured here is our tweet of the week. Mention us on Twitter at MedEconomics or engage with us on Facebook at facebook.com/medicaleconomics. Thanks for watching Medical Economics Weekly. Go to medicaleconomics.com for this episode's show notes with more information on all of the topics we covered. And to get more episodes, make sure to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. We'll be back soon with more healthcare and practice management news. Don't miss it.